Hi, I'm Dr. John Harper, and I'm from beautiful Oceanside, California, and I'm here with Joan Gerstein, and she lives in Oceanside as well. And I had asked her if she'd give us a few minutes and tell us a little bit about her journey with us here at our office. So my understanding is, Joan, that you had some health issues. What kind of problems did you have before you came to the office?
Well, I have diabetes too for a bunch of years, and the last couple of years at least, I've had a numbness in the toes of my left foot that's directly related to neuropathy from the diabetes. I've had constant problems with mostly the left leg that my doctor says is coming from the lower spine.
Yes.
And so I had constant 24-hour pain. Sometimes it was dull, but it would wake me up at night, and then it would move around. Sometimes it'd be in my buttocks and my hip, but it was just never gone. And then I also have arthritis in my back that was painful, and after 5 minutes of just standing, I would want to sit down because of the back. And then on my right foot, I broke my foot in my 20s, and I have arthritis on the top of it, and after walking or standing on my feet for 30, 45 minutes, that would start to hurt a lot. And it was really limiting my lifestyle because now that I'm recently retired, I want to be able to go traveling and stuff. I couldn't do anything like that because I was always in pain.
Okay. And it's my understanding that you met us through one of the workshops that you came to. And I also understand that you had gone to some other introductory things
Yes.
To try and help you explain what they do for try to help you with these health issues. What made you decide to give us a try?
Well, it seemed a little more comprehensive because it wasn't just like machines, it was the whole person. But the other thing, because money is really tight on a fixed budget, for me, it was the fact that you said, for $65, I'll give you an examination and you can try it twice.
Two treatments.
Two treatments, which
Right.
was the whole, lasted like, each one lasted an hour, hour and a half.
Right. Okay. Very good. And you thought that that was a reasonable thing to try.
Yes, and that would help me determine. And after the very first treatment and my sample treatment, I walked out of there, and the pain that was 24/7 on my left leg had diminished like 70%.
Fantastic.
After one session.
After one session. Fantastic. So that kind of gave you some hope that we could help you out.
Yep.
Great. And so tell us a little bit. You've been here for 6 weeks now. And so tell us a little bit about how you're doing.
Well, the pain is gone 99% of the time. Every once in a while it wants to like manifest itself for a minute or two, and I just sort of ignore it.
Right.
And I can stand and walk for hours.
Wow.
My dog is very happy. We're going on a lot of long walks.
Great.
I can stand. I could just do endless housekeeping chores if I choose.
Yes.
And nothing hurts my back, although I know when I move my back around, I still have the arthritis. And the same thing goes for the top of my right foot.
Right.
So I'm like 1,000% better pain-wise, but equally as good as that is that my energy is back to the way I used to be. I didn't realize I was walking around depressed for a few years, and I'm like full of energy.
Fantastic. Now, I would assume that a lot of people hearing that your energy is so much better is interested in that, especially people with diabetes. Now, one of the reasons why we're doing this video is that because people are very skeptical. They think that, you can't help peripheral neuropathy, you can't help sciatica, you can't help somebody with diabetes get energy and feel better again. What would you say to those skeptical people?
I said it's realistic to be skeptical. My doctor, when I would go to her, she never offered any of these treatments. The most I got for the pain in my leg was to go to an occupational therapist who gives you exercises and stuff, and it helps a little, but it's like I felt like I was a young retiree, and I've been given a life sentence of having a miserable retirement because I have all these years left that now I can play, and I couldn't play. So it's okay to be skeptical, but this is very comprehensive because it includes your diet, it includes the supplement. It's just the whole package.
Good, good. So you feel like we looked at you as a
Yeah.
whole person, not just your feet or just your energy. We took on everything else.
I do not regret coming here at all.
Fantastic, very good. Well, thank you very much, Joan. I do appreciate that. If all my patients were as kind and generous and funny as you are, it would be even better to be here. With all that, I hope you have a very lovely day, and thank you.
Thank you.
Hi, I'm Dr. John Harper from beautiful Oceanside, California, and I'm here with Bill Penn from San Marcos. And he graciously offered to do a video testimonial for us. So, Bill, tell me a little bit about the health issues that you had before you came in here, and what kind of things did you do before you came to my office?
Mainly, I was suffering from the peripheral neuropathy.
Mm-hmm.
The foot and the leg pain was the biggest problem. I couldn't sleep at night, and I was hoping to get off the medications, and I was trying acupuncture before I met you,
Mm-hmm.
and I went to a chiropractor for some treatment,
Okay.
and I needed to get off the pain. That wasn't relieving the pain very much. So.
Right. Okay. And you said that you had some temporary relief using those other means,
A little
but
temporary.
but didn't really fix it.
That's right.
Okay. And how did you happen to come be a patient in our office? How'd you find us?
I saw your advertisement on email.
Okay.
Email came through, probably Facebook. I believe
Right.
it was, inviting me to a workshop.
Okay.
So I was happy that I came to that.
Good, good, yeah. And so, when we made an offer at the end of the workshop, what made you decide that that sounded like a good idea?
Well, I was pretty impressed with all the testimony from all the previous patients,
Mm-hmm.
and you were pretty straightforward. I liked your presentation. I figured that would be something I wanted to give a try.
Good, excellent. So, so you came into our office and we did the evaluation. And when it came time for me to make my recommendations, was I real straightforward with you about time and finances and the your responsibilities and my responsibilities?
Yeah, you were very straightforward.
Good,
Very.
excellent, good. So here we are, 5 months later, right?
Okay.
And so, so tell us how you're doing now.
I'm feeling much better.
Good.
My energy level is up. My pain level is probably about a 4,
Okay,
or maybe a 3
Okay.
at night. When I
Great.
used to have the pain that was a 9 or a 10, and so I'm able to rest and sleep better, and I can go through most of the day without any pain most days.
wonderful.
And then at night a little bit of discomfort, which is normal,
Right.
but not nearly as bad as it was. So
Good.
it's much better.
Fabulous, fabulous. And so, you've dropped a little bit of weight since you've been here?
15 pounds so far.
Excellent, very good. And you weren't a chubby guy either, huh? You really
I
trimmed
feel
up.
good about that.
Excellent.
Very good, yeah.
And then also, part of the issue was blood sugar. You were having,
Right.
you're diabetic and you take medication. And so what's happened to your blood sugar since you've been coming here?
I've been looking at the numbers every morning, and it's consistently low now
Excellent,
by, I would say, over 20-25 points on average,
wonderful, good,
and it's staying at a pretty level.
beautiful, beautiful.
So,
And if I remember correctly, you're talking to your physician about dropping some of the meds, is that right?
That's exactly right. Yeah.
Awesome. Good for you, Bill. So, Bill, one of the main reasons why we do these videos is that people are very skeptical, and I understand that. If somebody was contemplating coming to our office to see if they were a good candidate for one of our recovery programs, what would you tell them?
I would say this program is worth the try. It worked great for me. I would highly recommend it. I've already recommended it to several people.
Very good.
So hopefully they'll come see you,
Very good,
It
Bill.
works.
Very good. Well, hey, Bill, you sure been a great guy to work with, and I sure appreciate your attitude. And, oh yeah, another quick question here. You mentioned that you're sure enjoying the golf game now, huh?
Oh, it's much better.
Much better, yeah.
Yeah, I'm playing consistently at least once a week, and the game's getting better. I'm not exhausted by the end of the round like I used to be.
Excellent. And your balance is better, and you're
much
hitting the
better.
ball better. Good.
Mhm.
So for all our golfers out there, they'll want to know
Yeah.
about that. So anyway, Bill, hey, thank you very much. Really appreciate it for the time, and great working with you. And you have yourself a great day.
Thank you. Thank you.
Very good. Hi, I'm Dr. John Harper from beautiful Oceanside, California, and I'm here with Chuck Johnson from Chula Vista. And Chuck's going to share a little bit of information about his experience with our office. So, Chuck, tell us a little bit about the problems you were having before you came into our office.
Well, I've been type 2 diabetic for 2 years. No, 8 years, I'm sorry.
Right.
and my feet were starting to burn and get cold. My legs were getting heavy, and I would get tired really easy walking. Was getting leg cramps at night, and my balance wasn't, I don't think, what it used to be
Okay.
when I was younger.
Right. And my understanding is we were pretty much the first shot as far as with the peripheral neuropathy, right? We were the first office you came to get
Yes,
checked out.
I didn't even know that anything could be done about it.
Right, yeah, because you were told probably, I don't know if your physician had mentioned, but most of my patients say the physician says you just have to live on these drugs, and that's just
Well,
pretty
they
much
were
it.
concerned about it, but
Yeah.
I wasn't taking any drugs for
Oh.
the neuropathy.
Great. So, how did you happen to find out about us?
I get the UT every day, and then on Tuesday they have a health section, and you had your workshop advertised in there, and so I called the number and set up an appointment to come to the workshop.
Great. And so, when you came to the workshop and you listened to what I had to say and what I was recommending, what made you decide to try it out and be a patient?
Well, it was it was very interesting, the information you gave, and I didn't know that about the problems you could have with your spine affecting your nerves, and plus you offered a $65 trial for 3 sessions, and I figured $65 is fairly inexpensive to see what it was about.
Okay, good. And so, in those 3 sessions that you came in, did we do what we said we were going to do? Did we tell you about the care, all in writing, about the time and the money involved, and were we real clear about everything?
Yes, you were very upfront,
Okay,
and that's what appealed to me.
good, good. Me too. I like being upfront, and I like people upfront with me. So Chuck, here we are, 4.5, 5 months later. Tell us how you're doing now.
Well, my numbness and the burning and cold sensation in my feet, it was, I think when I first came in, I described it as about a 9 on a scale of 10.
Right,
And
pretty bad. Pretty bad.
Yes, and it was about 75% of the time.
Mm-hmm.
Now, after my treatments, that sensation in my feet has gone down to about a 2 on a scale of 10.
Great.
And about 25% of the time. It's
Beautiful.
not completely gone, but
Right.
and as far as the tired and heavy legs, that's much better. I can walk a little brisker now,
Right.
and the sleep, it's about, a big improvement in my restfulness. My rest at night. It's
Beautiful.
gone from, when I came in, all my symptoms were about a 9
Yeah.
out of 10, and now they're all down to about a 2,
Beautiful.
25% of the time. Oh, also I had balance issues, and that's a lot better.
Good.
All 4 issues I had improved tremendously, but I will say this, they're not 100% cured.
Sure.
And I wasn't really expecting that.
Right.
I just wanted to get a little better so I
Sure.
can enjoy my life a little more. I like to play golf, and I want to start riding a bicycle again.
Perfect. And we're saying that's a good go to do. That's what we're saying. Let's do
Right.
that. So Chuck, the reason why we do these videos is that people are very skeptical, and I completely understand that. And if somebody was watching this video and they're skeptical about at least trying to see if we could help them, what would you say to that person?
I would say come and check out the workshop, check out the information you have to give, and $65 is not a big investment to see what the treatments would be like, because after the first 2 treatments I started to feel better.
Great.
And I wanted to get on with the program.
Beautiful. Very good. Well, hey, Chuck, I just want to thank you very much for your time today. I'm so excited about your improvement. I can't wait to hear about your golf score and the enjoyment of back on riding bicycles. And I sure wish you a very pleasant day. Thank you very much.
Thank you.
Hi, I'm Dr. John Harper from beautiful Oceanside, California, and I'm here today to share you with some information to let you know that you too could beat diabetes and pre-diabetic conditions, and you can do it naturally. Using functional medicine and functional neurology, you are allowed to not only feel better, get better, but you'll get off those medications or really decrease them. Your body will start working the way it was meant to, and the most important thing is you're going to get your life back. So, what are we going to talk about today? Well, first of all, what is diabetes? What causes it? And most importantly, what can be done to get you healthy again? So a little bit about me. I'm Dr. John Harper, DC. I've been in private practice since 1986. I have personally consulted, examined, and treated over 7,100 patients during that time. I am a board member of the American Functional Neurology Institute. You might wonder, what does neurology have to do with diabetes? Well, have a seat and be ready. I'm going to let you know here soon. I've been granted numerous awards and certifications in those 28 years. I regularly attend conferences and symposiums to stay on top of the newest research, diagnostics, and protocols. Personal information, I'm a third-generation Californian. I live here in Oceanside. I have 4 children and I have 4 grandkids, and just wanted to share something fun here. This is the newest 5th-generation Californian. Caleb, my grandson, my 4th grandchild, was born a few days before Christmas here in 2014. Also, I want to let you know a little bit more about me and how I got involved with taking care of people with diabetes. Share a little bit about my story. Originally, I had a kind of a regular chiropractic practice where I would adjust spines, and very enjoyed that and had a lot of fun and helped a lot of people get better. But about 5-6 years ago, I myself started getting sick. I put on 80 pounds in 3 years, went to all their kinds of doctors. They couldn't figure out what was wrong with me, and kind of to my embarrassment and shame, here's a picture of me at my heaviest there. Kind of makes me sad to see that picture again. What happened was that I had numerous metabolic issues that were undetected using regular medicine and going to regular doctors and even specialists, endocrinologists, internists, you name it. Eventually they said that all my problems were that I was eating too much food and not exercising. For 3 weeks I was on an 850 calorie a day diet, which is less than half for somebody my height. I was exercising about 2 hours, 6 days a week. I still wasn't losing weight, still didn't feel any better, and eventually I just got so sick I was sent to a psychologist, and the psychologist said this was a mental problem. I was put on medications for antidepressant, and after about a month and a half of that, nothing was any better. I woke up one morning and I just thought it would be better if I wasn't here. That changed everything. I got on my horse, went outside of the normal system, started thinking outside of the box. I got a book, and in the book it started talking about me, all my symptoms, all my problems, and that physicians and labs and traditional medical care couldn't figure out what was wrong with me. And I was able to find a doctor who knew how to take care of these problems and got me squared away. And not only did he teach me how to take care of my own health, he taught me how to take care of yours. And that's how I become this doctor that even though I'm a chiropractor, I take care of a lot of things, a lot of chronic problems. So let's talk about that. So all chronic health conditions, they have some common threads.
type 2 diabetes, insulin resistance, which is also known as metabolic syndrome. We're having thyroid conditions, fibromyalgia, vertigo, sciatica, chronic fatigue syndrome, peripheral neuropathy. Probably some of you folks suffering with diabetes, about 60% of you suffer from peripheral neuropathy as well. Rheumatoid arthritis, chronic neck and back pain, stenosis, irritable bowel syndrome, insomnia, celiac disease, migraine and chronic headaches, ADD and ADHD spectrum disorders. All these things have something in common, have the multiple common threads. There could be metabolic imbalances. You could have anemia, thyroid dysfunction, unstable blood sugar. Well, yeah. You're having adrenal gland dysfunction, hormone imbalances, autoimmune attacks, hidden infections, food sensitivities, hypoxia, which is low oxygen due to anemias, chronic inflammations. All these things can cause lots of issues that are not found or detected by the normal medical approach to these conditions. Also neurological imbalances, decreased firing of the brain through fatigue. Your body is one system. Unfortunately, the medical profession looks at you as pieces and parts and looks at you like a test tube, so that's why we throw chemicals in your body. So all cases, every chronic condition is a combination of neurological treatment and metabolic treatment. If you have an acute problem, get in a severe car accident, break a leg, have a heart attack, a difficult birth, boy, do it in the United States. We are number one at getting people taken care of with acute conditions. Matter of fact, 8 years ago, I had kidney stones, and for any of you who have suffered from kidney stones, you know that this is horrifically painful. Thank God for medication and surgery and all that, and they take good care of me. But when it comes to chronic conditions, we fail. We fail horribly. The World Health Organization puts us about 48th in the list of countries, as far as industrial countries as well, of our health and longevity, and it just doesn't work. So let's talk about the metabolic side of things, and the neurology and how it works with each other. So metabolism essentially is that your body wants you to eat food and it wants to turn it into energy, which is your glucose. So let me ask you a question. There's one of the systems in our body that uses almost a full third of all the energy that we take into. Is it your endocrine system, digestion? Is it the nervous system? Is it the immune? Is it the cardiovascular? Well, let me tell you, it's your nervous system, the brain, spinal cord, and your nerves. We need proper glucose delivery for proper metabolism. That's energy, and for a well-functioning brain. I want to let you know something very clearly right now. One of the biggest problems people suffer when they have diabetes or pre-diabetic conditions, that poor blood sugar causes a bad brain. You might be forgetting things. You might be changing your mood. I hear this. The spouses and significant others say, please, Dr. Harper, I want my husband back. I want my wife back. That person's gone. Ever since they've been sick, they don't have the same kindness and gentleness, and they're not as loving and fun to be with. We start isolating each other, and we don't want to be with each other. But I want that person back. Help me with that. So these are the kind of things that we get when we get a bad brain. Also, bad brains can cause insomnia, anxiety, depression. So all these things can be affected just by your blood sugar. So let's talk about how physicians diagnose diabetes mellitus, okay, or type 2 diabetes. So the classic symptoms of diabetes mellitus is polyuria, going to urinate quite a bit, polydipsia, thirsty, wanting to drink a lot of water, and polyphagia, unrelenting hunger. You're never satisfied, and it's kind of interesting. They look for weight loss and random plasma glucose of over 200 milligrams on non-fasting. So fasting glucose over 126. 2-hour post glucose load test, the plasma glucose over 200, and confirmed by repeating that test. Now, for any of you who have gone through that test, that is horrific. Why anybody would put you through that test, it just makes you sick as a dog. You don't feel well. People pass out from it. People get very sick when they just load up somebody who has sugar issues. They load you up with sugar. It's ridiculous. And then, or an HA1C of over 6.5, and we'll get into that a little bit later. So also this thing is called, there's a thing called pre-diabetic, all right? You don't fully have all those symptoms and all those blood test results, but what you do have is pre-diabetes. It's also known as metabolic syndrome, or it's also been called syndrome X. Why is it called syndrome X? Because for many, many years, nobody knew what it was. You know, hey, you're not diabetic, but why are you having all these health issues? And this is fasting glucose, blood glucose is over equal to 100 to 126. And I want to ask you a question. Is this you? Is this what your problem is? So type 2 diabetes statistics. Well, in 2014, there's over 29 million people in the United States that have been diagnosed with diabetes or pre-diabetes. That is almost 1/10, 10% of everybody. So when you're in the movie theater and there's 300 people in that movie theater, big movie theater, 30 of those people have diagnosed diabetes. So also 1/3 are undiagnosed. Oh my goodness, that's another 100 million. That's incredible. So it leads to the #1 cause of blindness in the United States. It also is the #1 cause of kidney failure in the United States. 60 or to 70% of all diabetes has some form of peripheral neuropathy, burning, tingling, numbness in your feet, maybe even in your hands. You have problems walking, pain at night that wakes you up. Big problem is falls. When your brain can't feel your feet because of those nerves being damaged, you fall. Guess what? In the United States, the #1 cause of death is falling in people over 60 years old. That's a shame. How would you like your tombstone to say, instead of something heroic or loving and wonderful about you, well, he fell. All right? No, we got to fix that. Last but not least, of those 60 to 70% people, they have sexual dysfunction. It is an amazing thing that I have people come in their 60s and their 70s, and one of their main complaints is they can't make love to the person they're in love with. What a disheartening thought that this is what it's going to be from here on forward. Now some people, they, oh, well, that doesn't matter to me. It's not that big of a deal. Actually, it never was. Now that's fine. But you know, for somebody that's important, it just breaks my heart to know that this person that just cares for somebody, that they've been with them for years or maybe even decades, they can't express that love in a physical way. And that really takes away the enjoyment of life. The early signs of this is bad skin, itching in the legs because the nerves are starting to die, your skin is starting to die, the blood vessels starting to die because of the damage that's happened because of the blood sugar. So how your body should really use blood sugar, all right? So you have about 100 trillion cells, and every one of those needs glucose. It needs energy, which is ATP. Right? Insulin opens up the cell to allow that sugar to get in. Cortisol from your adrenal glands elevates when the blood sugar is low. Now, your adrenal glands are part of the stress glands. All right, when your body's under stress, when the body's not working the way it should, the adrenal glands kick in. So stress causes adrenal stimulation, which reduces cortisol, and guess what that does? That increases your blood sugar. If you're under stress a lot, you're in danger. So there's lifestyle causes of insulin resistance. So waiting too long between meals, all right, you get an insulin surge. So this is what happens when your blood sugar goes low because you haven't eaten often enough. Then what happens is the adrenal glands kick in, and then that mobilizes some sugar, and then up goes your insulin, very high. Eating too many carbohydrates at once, that causes insulin surge. What's that? The insulin is supposed to be at a certain level coming out at a very steady rate, but instead it jumps way high, it empties your blood of the sugar, and then it crashes down. This causes so many problems. Consuming too much sugar causes insulin surge. This is an amazing statistic. Americans consume 100 to 170 pounds of sugar a year. Can you imagine? Most of you are eating your body weight in sugar every year. You know, don't worry about what it's doing to your teeth. Worry about what it's doing to your body, how it is ravaging your body. We are not built to put that stuff in there. Lack of exercise. And I don't mean you have to go to the gym for hours every day. I'm talking about simple things of just getting up and going for a walk. Americans, we are just getting sicker and sicker because of our lifestyle changes, and this has got to change. And then again, high stress, like I said, cortisol release. So all this causes chronically high levels of glucose and insulin, and your cells stop listening. You know, if you had somebody that was yelling in your ear, you would cover your ear and try to get away from that person. That's what happens in insulin resistance. The cells are just so scared to open up because there's so much sugar that it's going to just kill the cell with too much sugar. So now the cells are like, I can't take it anymore. I don't want anymore. And you become insulin. This is a terrible problem because this is the next step from hypoglycemia, insulin resistance, and then you're going to end up with diabetes. So what symptoms do you get? You get fatigue, increase in triglycerides, cholesterols, and LDLs through lipogenesis. You are never satiated. You never feel like you've got enough food in your body, because what happens is that when you are doing the insulin resistance, what's supposed to happen is when you eat and you have enough food, leptin is supposed to be produced by your body. The leptin goes up into your hypothalamus, which is part of your brain, and it says, hey, we don't need to eat anymore. When you go into insulin resistance, your body does not produce the leptin, therefore you never feel like you've got enough food. And this is one of the main reasons why people put on so much weight. What is the medical solution for all these problems? More insulin. More insulin. That's crazy. This is crazy, crazy, crazy. All right? Your body doesn't need any more insulin. So insulin, why use it? Why bombard the cells with insulin when the cells don't even recognize it anymore? And high levels of insulin cause all kinds of other problems. See, I used to think that physicians were somehow evil, that their whole thing was how to make money, was to, look, I'm going to have the patient come in, I'm going to give him this insulin. Insulin will never get them any better. They'll start developing peripheral neuropathy. They'll have to come in and get a medication for that. Then as the peripheral neuropathy gets going, their brain doesn't feel their feet. That causes brain issues. They're going to get depression and anxiety, so we'll give them they'll have to come in and get another pill for that. Or they're going to have insomnia, so now they need a pill for that. Or they're going to start getting memory issues, and so they need a pill for that. And so I used to think that. But as I investigated and figured out and talked to these poor people, I realized I'm looking at the wrong person as evil. Really, it's the pharmaceutical companies. Pharmaceutical companies are for profit. They are not there to help you. In the beginning, like when antibiotics got it started, heaven sent, saved thousands and hundreds of thousands of lives. People used to die from infections. #1 cause of death for millennia. What happens is now that we have antibiotics, people don't have to die. But then the pharmaceutical companies say, well, we have to make something else, and they make something else, Look, if you have type 1 diabetes and you absolutely have to have the insulin as a replacement, that makes absolute great sense. But when you have type 2 or you're pre-diabetic or insulin resistant, that's going to make it worse. So what ends up happening is it's the pharmaceutical companies that have talked to the FDA, have lobbied the politicians, and now there's certain rules and laws that physicians have to follow. And guess what? When your blood sugar is not the way it's supposed to be, what is the treatment? Insulin. That's it. The doctor is actually committing malpractice if they get your blood work back and don't give you insulin, even if that's the wrong thing to give you. Why? Because then you'll develop all these other health issues that will need all these other medications. I am absolutely horrified. People are coming in with 10, 15, 20 different medications, all from the same physician. Why are they doing that? Because it's the law. It's what they have to do. And then you got on the other side of the physician, you have the insurance companies. The insurance companies are actually the boss, right? They're the ones that write the check for the doctors. So now the physicians have to follow the insurance company's rules. Now, what is the insurance company there for? They have stockholders, just like the pharmaceutical companies. They have to make a profit. That's their job. Do you understand where I'm getting here? That's a loaded system. That system is not going to serve you. To get your health back, you have to step outside of that system. By stepping outside of that system, by thinking outside of the box, you are going to be able to get a chance to get healthy. You stay in that system, you are doomed. It is a death sentence that you will always be tied to those physicians, the medications, and the insurance company. Somebody other than you are running that system. Somebody other than you is deciding what's best for you and what is not going to be the benefit. And it is all about cash. It is so sad. So, high insulin, it's inflammatory. It causes inflammation. Inflammation in your body is like little machetes running around, cutting up the inside of the blood vessels, messing up the nerves, messing up your organs. Bad news. Insulin causes weight gain. It increases your blood pressure. It dramatically increases your risk of cardiovascular disease, cancer, stroke. Who wants that, right? Low testosterone in men and high testosterone in women. The way that our individual sexes addresses the insulin, you become more female as a man with insulin, and you become more manly as a woman with insulin. Maybe there's a few people out there that are happy about that circumstance, but the vast majority are not, right? And it's toxic to the brain, again, causing lots and lots of brain issues. The day you get on insulin, you are not going to be the same. It is a very strong, powerful medication, and it changes not just your blood sugar, but every system in your body. It will ultimately fail as your doses go up and up and up. So this is how insulin resistance and causes weight gain. So you eat your food. That's supposed to make insulin. But the cells they resist the insulin. So instead of the sugar going into the cells, where does it go? It's stored as fat, right? It becomes a storage system and for future energy. Then you still feel tired and hungry because your cells are signaling to the brain, I didn't get enough food. And you eat food. And you go back onto this merry-go-round, all right? Or one of my professors used to say, it's like a hamster in a wheel. You are running and running, but you're not going anywhere. And yet all this time, you're thinking that you're probably getting healthy, or you have some other condition because your physician says, nope, has nothing to do with your blood sugar, you're fine. What else controls your blood sugar? Well, your pancreas, right? Insulin is what puts the glucose into the cell for energy. Your adrenal glands. The cortisol elevates the blood sugar when needed. So if you're under physical stress, exercise, as you go to sleep, and hopefully you're sleeping 6, 7, 8, 9 hours a night, your blood sugar goes low, but your body's still operating. You need your adrenal glands to kick in. Your thyroid hormone, oh my goodness, every single cell in your body has a receptor site for thyroid. Therefore, thyroid hormone must be very, very important. This is one of the main things that we check into. This ultimately was my problem. My immune system was attacking my thyroid, and that was causing all kinds of problems with my metabolism, and that was causing my blood sugar to go all wonky. The liver, that's where the storage of the glucose is in the form of glycogen. That's where you store that when the body doesn't need it. As the blood sugar goes low, your liver's supposed to leak out a little bit of that glycogen, and that ups your insulin a tiny bit. Under normal circumstances, that works. But when you got liver problems, that ain't working. And then proper gut function, your digestive system. 70 to 80% of your immune system is in your gut. So when you cause damage to your digestive system because of sugar issues, you're causing problems with your immune system. That's exactly what happened to me. Thank God I found the right doctor to teach me how to get my health back. So let's talk about adrenal stressors. Hidden food sensitivities, huge issue, huge problem. You may not have full-blown throw up or diarrhea or constipation after eating certain foods, but it's still causing inflammation. Hidden gut infections, very common. Using standard testing, you can't find those gut infections. You don't know that they're there. Poor diet, do I need to say any more? Anemias and emotional stress, by just thinking certain things and by not taking care of the way that we use our minds, that causes stress, that causes adrenal gland to pump out that cortisol. High cortisol from the adrenal stress equals insulin resistance. You keep pumping out that cortisol, that keeps upping the insulin. At some point, again, it's like somebody yelling at you, the cells just go, I can't take it anymore, please stop. Let's talk about liver malfunction. Drinking too much alcohol, bad diet. You know what? Medication's very common reason why people have liver malfunction and damaged livers, because that's where the liver takes the medication. That's not a normal chemical in your body. Every chemical that's not supposed to be there turns up in your liver, and the liver tries to detoxify it. And if you keep taking all those medications, that's going to cause damage. That all causes to glucose elevation. Thyroid problems are most often not diagnosed. This is, again, what happened to me. Doctors that I went to didn't run enough tests. Why? Because the insurance companies say, look, you only need to do a TSH, thyroid stimulating hormone, and you may do a T3 or T4. When I check my patients to see if their thyroid's working right, I do 9 to 10 tests. 9 to 10 tests. Endocrinologists, they look at these 9 to 10 tests. They go, what did you do all this for? Well, because I want to get to the underlying cause. I don't want to just assume because somebody's TSH is high that they need to take thyroid hormone. That's ridiculous. The physiology of the body doesn't work that way. And again, the lab ranges are too wide. We're going to talk about that in a moment. So type 2 diabetes is a progressive disorder. This is important. Type 2 diabetes is a progressive disorder. It doesn't get better until you get to the underlying cause. It'll eventually cause neurodegeneration. What's that? It'll damage your brain, your spinal cord, and your nerves. Alzheimer's has been called the diabetes of the brain. Why? Because there's damage that's going on, and it looks a lot like sugar issues that are causing the Alzheimer's. And again, the worst symptom for many people is, like we said, is the sexual dysfunction, right? Both men and women, and it's all about nerve flow. Your nervous system runs every single part of your body, including your ability to perform and enjoy sexual relationships. It is simple as that. So the vicious cycle sequence of type 2 diabetes, it takes decades, all right? You'll get your blood work checked, you're fine. You get your blood work checked, you're fine. One day you get your blood work checked, oh, hey, you got diabetes, here's your insulin, then Mr. Jones. All right? It took decades for that to happen. This is why we're so successful at keeping people from getting diabetes, because we get them in the pre-diabetic stage, which is the time to do it. So cells slowly become resistant to the insulin, like we said. The cortisol levels increase, which is the stress hormone. Right? The sugar starts to pile up in the bloodstream because the cells don't want let the insulin open up, and then extra sugar creates swelling that creates crushes nerves and taxes the pancreas over time. So what happening is here is it's a very slow process. It is a chronic condition, and you barely know it even happening until one of these days, oh my gosh, I feel horrible, I fell, I can't feel my feet, I'm sick, I'm anxious, I have anxiety, I have depression, I have insomnia. It's so sad. It is so sad. So another cause is latent autoimmune diabetes mellitus. So what's autoimmune? Normally the immune system just attacks germs and viruses and parasites and things like that. But what can happen is that if you screw up your immune system, it becomes too active and it starts attacking different parts of your body. So 20% may have this, all right? It's initially that you're normal in weight, and then what happens is that you have GAD, glutamic acid, and excuse me, I'll do my best, is decarboxylase. Hey, pretty good. Antibodies. So the antibodies are showing that your immune system now is attacking the part of your pancreas that actually creates the insulin. You've got to get that and understand what that is and that. Now, you come in, you have a high blood sugar because of this, and you get insulin, that just makes this problem worse. That just inflames your immune system and it starts attacking your pancreas even more. Now, do you want to get to the underlying cause, or you just want to cover up the symptoms temporarily so your body can rot and get worse? Most people want the first. So it's important to catch this early, and it can eventually lead to type 2 diabetes. So what about high blood pressure medication known as beta blockers? Well, that increases your blood sugar. So got Atenol, Tenemirin, Cartol, Lopressor, Toprol, Levitol, and Inderol. All those things up the blood pressure. I have patients that come in and they say, oh, I've been taking high blood pressure medicine for 15 years, and now I'm starting to have all these other symptoms. I do my special testing, and guess what we found out? Pre-diabetic or diabetic. Metformin, all right? This is what we have. The brand names are Glucophage, Fortimet, Glumetza, and Riomet. And it's really important to understand that the medication still neglects to get to the root cause of the problem. And effectiveness declines with time, and then the pancreas eventually just stops listening and doesn't produce any of its insulin, all right? It's terrible. And when you take these medications, you have numerous side effects. Lactic acidosis, you become acidic on the inside of your body, which is a horrible thing. All right, B12 deficiencies, diarrhea, nausea, vomiting, flatness, abdominal pain, headache, shakiness, dizziness, swelling, nervousness, headache, weakness, seizures, dry mouth, shortness of breath, cough, runny nose, muscle pain. Many of you are watching this right now and you're going, oh my God, I keep going to the doctor for all these things and they just keep throwing medications at me. I'm getting medications for my medication. That's nuts. You're getting a chemical for a symptom that's caused by another chemical. You know, this is the thing, it drives me crazy. Physicians treat your body like you're a test tube. You know, when you're in high school and you're doing chemistry, you got this chemical and this chemical, you put this chemical in, this is what happens. In your body, that doesn't work. There's 10,000 chemical reactions going on every minute of your body. All of it regulated by your hormones and your nervous system. All right? And you throw these chemicals in, it just stirs everything up. You can't make a chemical go to your pancreas to fix your low insulin production. It doesn't work that way. All right? It's impossible. When you take these medications, they go everywhere. They affect everything. Blood glucose levels can be checked with 5 very important blood chemistry markers. And this is the things that it's so important to do. Fasting glucose, all right? That should be 80 to 100, all right? I know most physicians think that 126 is fine. It's not. Our bodies are meant to have certain levels, but they come up with these crazy lab ranges, and I'll explain how they get those in a minute. Inefficient. HA1C, this is the best marker. I'm going to explain all about that in a moment. Your triglycerides are 75 to 100, your cholesterol is 150 to 200, and your LDLs are over 120, all right? So when your body becomes insulin resistant, it takes the extra glucose in your blood, and it makes lipids. This is why you have the increase of the fats, right? This is why you gain fat when you become insulin resistant. And until you control your blood glucose level, you'll never be able to get rid of that fat. You can exercise like I did, you can eat low calories like I did, and your body hangs on to it like it's gold. Now that your brain thinks that you're starving because your cells keep saying, where's my energy, where's my glucose? It hangs onto that fat like it's gold, because guess what? That's the extra. That's the emergency. That's where you go when your body needs it. It's supposed to break down fat. But unfortunately, you've ruined that system. Your body just stores the fat instead of makes it available to you. So, HbA1c, let's finally explain this mysterious test. So the first thing that you need to know, it's the best marker of the severity of your sugar situation. So sugar is sticky, whether it's in the inside of your body or outside of your body. Just like you can take your finger and touch sugar that's on a table and, hey, look, it's stuck to my finger. It happens to you. It sticks to the blood cells. Red blood cells that float around in your body for approximately 3 months before they die. That's the lifespan of a red blood cell. So we can then measure how much sugar the red blood cells have picked up in those 3 months. So when you do your blood glucose, that's a snapshot. We're looking at how are you doing right this second, right now, based upon what you did yesterday or this morning or this afternoon. When we look at the HbA1c, what are we looking at? A movie. 3 months of a movie. And this is so important and so much better than just a fasting blood glucose. And the normal is 4 to 5/9. Normal labs, all right? Big giant lab ranges. But in functional medicine, which we're going to talk about in a moment, 5, all right? Right dead in the middle is where it's supposed to be. Anything beyond that, your body's not functioning the way it's supposed to. So, what are the keys that we need to talk about? Got to control that insulin and the cortisol levels. Got to make sure your thyroid and your liver are functioning properly. You got to have proper gut function. Like we said, food sensitivities, gut infections, going to wreck the whole system. So, what are the that's all the metabolic stuff, all right? What are the neurological consequences of type 2 diabetes? Well, decreased sensory input to all of the brain. Let's think about it. One of the main things that your brain does is receives information, all right? Your feet have to tell your brain where the ground is, what we're walking on. Your brain has to tell you about what's going on. You have to interpret situations when you're talking to people. You have to have ability, if you're driving a car and you need to avoid a kid running out into the street, you have to react just like that. All these things are damaged and slowed down because the nerves don't have the energy, don't have the ATP, don't have the glucose to function properly, and that causes fatigue. You can get dysfunction anywhere in the brain. You know, your brain is like a 100-apartment complex. There is all kinds of places, and they're doing all kinds of things. And if you start to have problems, you could have all kinds of symptoms because that part of the brain is not functioning right because of the problem with the glucose. It can cause multiple focal vascular lesions in lots of different brain areas. So what is a focal vascular lesion? If the blood vessels don't get their sugar, they're going to become damaged, and that, if you don't get sugar into the different parts of the brain and oxygen, you are a mess. This all causes a problem called neurodegeneration. So there's a brain-body connection. I want to share that with you. Your brain's a sensory organ. Everything's perceived in the brain. You know, you stub your big toe and you look at your toe and you go, ow, I hurt my toe. Well, all that was figured out in the brain. You know, if your brain wasn't connected to the toe, you would know that you had hurt your toe. Also, that perception of looking down, oh, this is where it came from. That's in the brain. You wouldn't know that you hurt yourself because that is all in the brain. Your body's one big receptor. Everything is in your body to tell your brain what's going on. Your brain stays alive from constant input from your body's receptors and the fuel in the form of glucose and oxygen. So not only does your brain need the glucose and the oxygen and the water, it needs stimulation. It is so important. We have receptors everywhere. In your muscles for gravity, in your joints for position, all right? In your skin for touch, in your eyes for light, in your ears for hearing, right? In your nose for smell, and in your mouth for taste. Not only does this tell your brain what's going on, it literally stimulates the brain to stay alive. And as you start having problems with insulin resistance or diabetes, those nerves don't work. Your brain doesn't get that. This is one of the main reasons why people with diabetes become old so fast. Your brain literally starts to shut down and not do its job. So I want to share this with you. This is a very important paper that was in the American Family Physicians periodical in 2010. Right? This is something that every internal medicine doctor, family physician, you would think even endocrinologists, neurologists, they should all know about this. When you decrease sensation in your body, it changes the way that your brain works. All right? Obviously, you know, if you can't feel your feet because of the damaged nerve from neuropathy, well, of course you're going to lose balance. But guess what else happens? You get memory loss, depression, anxiety, Alzheimer's, dementia, insomnia. So when I, as a doctor, take care of patients with these kind of chronic problems, the very first thing I say is, how's your blood sugar? Oh, doc, how'd you know? Yeah, I've been having problems with my blood sugar for a long time. You know, but that doesn't have anything to do with this, right? Wrong. I'll also ask them, hey, you know, what's going on with your feet? Oh, how'd you know that? I don't feel my feet, or I have this weird tingling, burning, numbness, all these kind of things. So why? Well, because I read this article and I put it into my practice. You know, and a few studies have come out over the decades saying that most physicians are 13 years behind. 13 years behind in the research. Is that insanity? Right? I mean, remember what cell phone you had 13 years ago? That big giant brick-looking thing with an antenna on it? Could you imagine if you were walking around with that thing today? People would wonder, what planet are you from? All right? And yet, the way that a physician practices, it's 13 years old. Right? This is why every year, 3, 4, 5 conferences that I go to. I even host in my office international conferences. Doctors from all around the world come to my office. I do a little bit of the teaching, but the vast majority of the time, it's people that are experts in this kind of treatment that come come to my office and teach us, and it's fantastic. I love learning. I'm coming up this month. I'm going to turn 56 years old, and I learn something every day from either online information or something a patient teaches me, or these conferences, and it keeps me healthy and happy and alive because I'm feeding my brain new things, and it's really exciting. And then when I take this and hand it to a patient and I treat them and help them get their lives back, oh man, hey, let's have a party, all right? Let's have some good time. So let's talk about just one simple thing. Your body has parasympathetic and sympathetic nervous system. Sympathetic keeps your, when fight or flight or things that are stress or something like that, the sympathetic system works for that. If you are the parasympathetic, does the normal stuff, your heart rate and your digestive system, and keeps it when everything's all calm. Well, what can happen is, let's say this diabetes or pre-diabetes or insulin resistance, metabolic syndrome, syndrome X, by whatever name you call it. What can that cause you? Well, chronic pain and chronic fatigue, irritable bowel syndrome, all right, urinary tract infections, fibromyalgia. Tons of people come into me for that. Migraine and tension headaches, poor posture. One of the things that your sympathetic system does is that when you're under attack, it tries to protect you, and so you bend forward. Well, if you're constantly in sympathetic chemistry, you're going to start bending over like this, hunched over person like Bigfoot. Adrenal gland stimulation, blurred vision, increased sweating, difficulty falling or staying asleep, insomnia, dizziness, vertigo, heart palpitations, increased heart rate, high blood pressure, cold hands and feet, sensitivity to light and sound. All right? Most of you are going, oh my gosh, I have so much of this. And yet you go to the physician and you say, oh, I have this, and what do you get? A prescription for a pill from a pharmaceutical company that's happy that you're getting another one. So so how do you know if your brain or nervous system is being affected by your condition? Well, a thorough neurological exam. And it's kind of interesting, in all these years that I've been in practice, and as my exams have gotten bigger and better and more thorough, essentially every patient says about the same thing, all right? I've never had such an exam. Dr. Harper is so thorough, and this is one of the things that I take pride in, is my ability as a detective to get to the underlying cause of your problem. Why are you having this poor health? Why is this happening? We've got to figure it out. People come to me and they say, well, how do you treat diabetes? How do you treat this? I don't treat those things. I treat patients. I treat people. Everybody's an individual. This is why we're so successful. You go to your physician, your numbers on your lab say this, everybody gets the same thing. Everybody gets the same thing. You are not the same person, all right? Even your twin could have something totally different than what you do, even though you have the exact same DNA. But your body's different from different experiences for over decades. So, again, I'm a detective first. That's my first job. So, in addition to that neurological exam, our office is one of the few in the country that uses qualitative EEG to evaluate the brain, and then we use neurofeedback to retrain parts of the brain to become healthy again. This is amazing technology. It's biofeedback. By finding out what part of your brain isn't functioning right, and then by doing the proper treatments, we can fix your brain. It's fantastic, and it's really simple how it works. So, let's talk about this doctor here. Dr. Frank Duffy, all right? This guy is one smart dude, all right? He's a neurologist. He's the head of neuroimaging department and of neuroimaging research at Boston Children's Hospital, one of the #1 hospitals in the world. He's a Harvard Medical School professor. He conducted an independent review for the literature on neurofeedback for clinical EEG, and he summarized his findings as the following. The literature, which lacks any negative study of substance, which means it didn't cause anybody to be sick. There's no terrible side effects. There's no side effects at all, like all the medications. It lacks any negative study of substance, suggests that the EEG biofeedback therapy should play a major therapeutic role in many difficult areas. Listen to this. In my opinion, if any medication had demonstrated such a wide spectrum of efficacy, it would be universally accepted and widely used. Isn't that amazing? This Harvard medical professor looked at all the research, couldn't come up with anything that was negative about it, and very much went and said, if there was a medication that was this effective, we would all be on it. Now, you could probably guess what my opinion is why it's not widely used. Because if people got healthy using natural methods, what would that do to the pharmaceutical companies and their profit margins? What would that do to their stock prices, right? Okay. So let's talk a little bit about this. So you have essentially 4 main brain waves in your brain. You have delta, theta, alpha, and beta. The simple way to understand this is, let's think of these 4 as members of a band, all right? You got your drummer, got your bass player, got your lead guitar, got your lead singer. When you have 4 people in the band and they all play the same song at the same tempo, at the same volume, in the same key, it sounds like a good song. But we all have hearing that is attuned to when somebody's out of key, somebody's playing a different song, somebody's playing at a different volume, or somebody's playing at a different tempo. And the song's going to stink. It's not going to sound good. Well, your brain waves are the same thing. When all your brain waves work the way they're supposed to, guess what happens? Your brain works the way it's supposed to. But when it doesn't, when somebody's out of tune or playing the wrong song, it shows up as a symptom, because your brain controls everything in your body. Every single part of your body, every function, every thought, every emotion, every movement, every sensory, every digestion. Everything your body does is based upon what the brain does. And if your brain isn't functioning the way it's supposed to, you're not functioning the way it's supposed to. And believe me, throwing chemicals at it is not the solution. This is the solution for these brain problems. It is so amazing. You watch a movie. That's it. You watch a movie. See, once we have this brain map, and every one of these are supposed to be green, all right? And so if you see yellow, if you see red, that means that that brain wave is too high there, all right? It's causing too much. It's too loud, too much volume. If you see light blue or dark blue, that means it's too low. It's not loud enough. It's just even playing the wrong song. So what we want to do is we want to make all these green. And how do you make them green? You watch a movie. So as you sit there, you have little sensors on you. Now, there's nothing going into your brain. It's a sensor, just like a thermometer. You put it in your mouth, you read it, right? You have to break the thermometer and the mercury goes inside your body. That's a problem. This is just a sensor. And as you watch the movie, we tell the machine that we want to train down the high spots, we want to train up the low spots, and as long as you're in 85% training, the movie's there. But when you're not training right, as the brain kind of drifts away, within 1/10 of a second, you go out of that 85%, movie's gone. You can't hear it, you can't see it. And your brain goes, hey, I was watching that. You know? It's just like when somebody's watching the big game and the big play's coming up, and somebody walks in front of the TV and starts talking to you. You're like, hey, I'm watching this. All right? You're so in tuned on it that you're focused on it. The brain is so smart, it starts going through this filing system, and it starts looking for how to get the movie back. And when it starts training the brain properly, within 1/10 of a second, on comes the movie. The brain goes, hey, I know how to get the movie to work. And you just sit there and watch. And as long as the brain is training properly, there's the movie. When it's not, it goes away. This is just like how you learned how to ride a bicycle. Remember back to those days, all right? When I was about 4 or 5 years old, time to learn how to ride a bike. Now, I started off with the training wheels, like most people of my generation, but then what did we do? We took off the training wheels, and what happened? I'd go this way for a little bit, and boom, I'd fall to the right. I'd get back on there. I didn't have to think about it. My brain thought about it, says, hey, I want to fall to the right. Then what happened? Oh, fell to the left. Eventually, my brain had feedback and learned to keep me upright and going forward. And that's how I learned how to ride a bike. And just like learning how to ride a bike, this is permanent. For instance, when I got on a bike about 5 years ago, I hadn't been on a bike for over 20 years, right? And when I got on the bike, at first it was like, whoa, this is a little weird. But within 10 seconds, I was riding the bike. Within a minute, I was riding the bike without my hands, all right? That was one of the dumb things that I did as a kid, thinking that was fun, right? Showing off. So the thing of it is that just like you learned how to ride a bike, these changes in your brain are permanent. The brain knows how to keep the body functioning, the brain learned how to keep itself healthy and working the way it's supposed to. So let's get into metabolic disorders that cause brain imbalances. Anemia, sugar imbalances, again, pretty, like another duh moment. Food sensitivities, immune system imbalances, adrenal gland disorders like we talked about, thyroid disorders like we talked about, inflammation, hidden infections. How do you know if you have these things? You got to have proper testing, all right? Again, you got to step out of the drug companies' way of doing things that they have lobbied the FDA and the politicians, so physicians are forced to do only certain tests, so they'll be made to go to certain medications. You've got to step outside of that system. You've got to think out of the box. So, you've all been told that you're normal, right? Isn't that frustrating? Maybe your blood sugar's off, but everything else is normal. Well, lab ranges are totally inaccurate because they use bell curves. This is how they figure out what's a normal lab, all right? So every year the results go into, I'm not sure the organization, but they take it, it's a government agency, and they take it and then they say, okay, so we're going to use a bell curve to know what's normal and what's not normal, all right? So you take this, so 20% is going to be way too high. 20% is going to be way too low. 60% is going to be considered normal. Well, this doesn't work right because, listen, think about this. If we took everybody's blood work when they were healthy, this might be a reasonable system. But who's going and getting their labs done? Healthy people? Maybe a few, but the vast majority are sick people who go to the doctor who get blood work, right? So we're trying to figure out what's normal and healthy for sick people. Quite the conundrum, isn't it? It doesn't make any sense. See, this is why I use functional lab values. They're way more sensitive to reveal problems. And these things have been established by the Endocrine Society. Endocrine has to do with chemicals and the hormones of the body. These people know. So, this is why your lab tests are normal, but you still feel sick. Isn't that frustrating? The physician comes to you and says, oh, you're normal, you're okay. Okay, doc, thank you. What? No, sorry. It's just, over, nearly 3 decades of dealing with this, it's just frustrating, But again, physicians are stuck in a bad system. Patients who go to doctors, medical doctors, are stuck in a bad system. Sorry. So here we are. If you look here, again, here's your 20% that are too low, 20% too high, and here's your 60%. I use smaller ranges. I use functional lab ranges. I use this little smaller thing. This is what I tell patients. Normal lab ranges, this is just so you're not dead. This is so you're healthy. Mrs. Jones, which of the two you want to be? Just not dead, or do you want to be healthy? Pretty simple. So let's talk about this. Let's talk about your glucose. So if you go and have your blood glucose taken, all right, traditional high-low ranges are 65 to 110. That's considered normal. On the right there, you see test results and interpretation, 73. Well, if you use traditional ranges, that's normal. But if you look under functional ranges, I use 85 to 100. Right? This is optimum for your health. Right? You have hypoglycemia. Your blood sugar is low. If you went to a physician and you were told this was normal, you're fine, but you still feel sick, and guess what? You go from hypoglycemia to insulin resistance to diabetes. Isn't that great? So this is why I use functional ranges, because I can save people's lives and get their health back by using these functional ranges. So your cerebellum and your brain require 2 things to function properly, right? It needs fuel and good glucose, like we said, 85 to 100. It needs proper oxygen, and it needs tons and tons of activation, all right? Known as brain exercise. This is what makes our office so different from every other doctor that you've ever seen. We treat patients neurologically and metabolically. If you don't take care of all the underlying causes of your health issues, you can't get better. You can't pick and choose. You have to address them all. Because if you don't, that one problem that you don't take care of will exert its influence on you and make you sick. You may have some temporary relief by shooting up with insulin or maybe doing some mild lifestyle changes, but it won't fix the problem, right? And I'm here to tell you, I will never, ever leave an unturned stone, all right? No stone is unturned in my practice to know the exact reasons why you are having your problems and why you're having your condition. Again, I take pride in my ability as a detective to find this out. So, pretty interesting here, this graphic. So, metabolic complications with breakdown. This is your body right now. It is sick. It's in pieces. Nothing's connected. Nothing's working the way it's supposed to. This is a huge problem. So, correcting the metabolic dysfunction, sorry. So correcting the metabolic dysfunction and the brain misfiring starts to bring the pieces back together. Then the periodic evaluation, I'm so sorry, periodic evaluation lets us know that we're on the right track. See, it's coming back together. And guess what? Bring together all the pieces because we treated the whole person. This is a holistic approach. This is reality, folks. We're not test tubes. You can't just throw a chemical in people and expect that's going to fix anything. I know the drug companies would love for you to believe that, and actually most of you do believe that. You've been brainwashed by watching commercials. We've been brainwashed. I'm sorry. It's the reality of it. It's all about the big dollar, right? When I was 13 years old, I remember sitting with my family watching a TV commercial. I think it was Orange Crush. And it showed these guys sitting on the beach kind of all bored. And one guy showed up with a case of Orange Crush, all right, this soda. I don't even know if it's around anymore. And all of a sudden, these really cute girls in bikinis showed up, and people were playing guitars and singing and having a bunch of fun. And guys and gals were holding hands, and they were playing volleyball and having a great time. When that commercial stopped, I turned around and said, "Mom, we need some Orange Crush." She says, "Why?" And I said, "Because I want to be with a bunch of really cute girls at the beach." I was brainwashed, all right? Think of the thousands of hours that you've watched this stuff. You know, maybe with your DVR you don't watch so many commercials anymore, but it's still in there, all right? You are so desperate, and your brain is so sick that it's gullible and it believes this stuff. Now when they have a medication on television advertising it, what's half the commercial? There's 30 seconds of stuff that's going to cause you damage. Even some of them are cause of death. Even my 6-year-old granddaughter goes, "Grandpa, why would anybody take something if it could kill them?" I don't know. So, what's next? All right? So, in the first 2 visits, what do I do? All right? This is another thing I pride myself in. I let you know everything that's going to happen, step by step, and very clear. There's no surprises in my practice. I don't want to do that. That's the benefit of being a good doctor for 28 years. We've ironed out all the issues, ironed out all the problems, and now we know how to do this, how to make it smooth and show you the respect and the care that you deserve, right? You're a person. You're a human being. I know what it's like to feel like crap. I know what it's like to be frustrated. I know what it's like to go, "I don't even want to be here." I don't want that to happen to you. I fixed myself through the treatments that I've learned. I want to fix you. I want you to be happy and healthy. So this is what I do in my office, right? So in the first 2 visits, visit 1, I do that complete neurological examination that people are so amazed by. Review any existing labs. You got some labs previously? Bring them in. I'll point out where they're not right. You're going to fill out what's called a metabolic assessment form. This is about 150 really nosy questions that you rate on a 0 to 3 as far as these symptoms. These will tell me enormous amounts of information what's going on. Enormous. It'll save you thousands of dollars. So when you come into the office, please fill this out properly, all right? Especially men, gentlemen. We are just like, they'll come in and every category has zeros, not individually circled, but like this, I go, fill this out. This is not right. Oh, I don't have time for that. Great. You're going to be really unhappy when I tell you what it's going to cost to get this treatment and all these blood work tests that the insurance is not going to cover and that. They say, hand me that piece of paper. I'll be right back. Got to be with your spouse or significant other if applicable. If you have somebody in your life that you live with that has any say on what you eat, how you sleep, your physical activities, if they're going to have any influence on whether you come to my office or not, whether you pay for my care, any of those things, they got to be there on day 1. They've got to be there. This is a teamwork approach. I will not accept a patient. I have minimums, all right? to get great results, there's certain things that have to happen. One of them is everybody has to be on board. Everybody. You cannot change your lifestyle on your own. If you have somebody in your life that is part of your routine, they've got to be there, period. No exceptions. You show up without the spouse being there, you're not serious. We're not going to do this. On day 2, if I can accept you into my recovery program, I will overview further testing to be done. What specific things, based upon your history, your symptoms, and that nosy paperwork, and the exam, what do we need to do? Review of the neurological findings from the first visit. Overview the treatment plan and review the fees. Now, this is what I do that's different than anybody. I will put everything in writing. Everything. My patients leave with a 15 to 20 page booklet that I have customized for them personally to let them know what treatment we're going to do, what testing we're going to do, what things that you're going to do. If you have some issues that need some therapy in my office, then we're going to do that. All that's there. Also, anything about fees. Anything that has to do with your time and money is always in writing, always. I don't mess around with that. There is no funny business. I will never ever put the patient or my front desk person in a situation where, what do you mean $100? What do you mean this? I didn't know about this. I didn't know my insurance wasn't going to cover that. That never happens in my office. Look, folks, I treat you with respect, all right? I treat you the way that I want my parents to be treated. Unfortunately, both my parents are gone. Unfortunately, both of them were pretty much at the hands of the medical profession, right? I don't want that to happen to you. I don't want your kids to go through what I went through, right? It's not right, it's not fair, and we treat you right. I promise you. And again, your spouse or significant other, anybody with any influence on you about the care or your lifestyle, they got to be there that second day as well. So, I'd like to make an offer for you here to come into my office and see if I can help you. So because of office time limitations, I only bring in about 10 new blood sugar patients per month. Usually the first 2 visits, the exam and the report is usually a $450 value. If you wish to make an appointment after attending this workshop or watching the DVD, right, I'm offering this $450 value to for $65. Why? Well, I don't want you to pay me $450 to tell you I can't help you. I don't want you to pay $450 for me to say, I'm sorry, Mrs. Jones, this is too far gone. Or, I don't believe you're going to follow my recommendations. Have a nice day. So for the $65, you're going to come in and have those first 2 days. Now, if you call here soon and you make your appointment and you've seen this video, I will include brain mapping and 2 days of treatment that apply to your specific case in addition to the exam and the what I call the report of findings, the day 2, with all that information package that we sent you home. Why do I do all this? Because I want you to know what I do. I want you to experience it. I'm not going to expect you to just jump into something when you don't know what it is. I use the analogy of I have never, ever, ever bought a car that I didn't drive. All right? I know some people buy cars from far away and then they get them delivered and I think that's nuts, all right? I get in the car and I drive it. I drive it quite a bit because I'm going to put a lot of time and money into this car, all right? I need it to be safe. If it's for my children, it's got to be safe. So I want you to experience what I do. So what else do you need for your first appointment? You're going to bring shorts or wear sweatpants and a t-shirt. Why? Because I need to get to your skin from the elbow down and from the knee down. I got to check the nerves. This is part of my neurological examination. I want to be thorough. And I'm tired of gowns. I'm tired of looking at people's rear ends, all right? I want you just to have this. I want you to be comfortable. I want to be comfortable. You got to bring all that paperwork filled out completely or we're done. And again, bring your spouse or significant other, otherwise we're done. Yeah. Look, I only want people who are serious. If you can't do these simple things before you get to my office, you're not serious. Let's talk about commitment and insurance, all right? I have 3 rules for acceptance into my recovery program. You've got to be willing to make lifestyle changes. You've got to, all right? If you come to my office and you think I'm going to give you pills or vitamins or shots or do some kind of magic therapy and you're going to be able to keep doing the things that are making you sick, you're out of your mind, right? That's nuts. It's not going to work, right? You know, Albert Einstein says the definition of insanity is doing the same thing over and over and over and expecting a different result. All right? We've got to make those changes. All right? You have to take accountability for your health. It is an amazing thing that people think that the government's supposed to fix this, my parents are supposed to fix this, my kids are supposed to fix this, my doctor's supposed to fix this. You know, fill in the blank. Teacher, preacher, you know, whoever. Somebody else is responsible for my health. No, you and you only are responsible for your health. And until you take responsibility for your health, you will never get well, you will never get better, and the end will not be pleasant. Take responsibility for your health. Insurance or Medicare only pays for a small portion of this care, if any. Let me say that again. Insurance or Medicare only pays a small portion of this care, if any. Again, it's a bum system, right? It's been rigged for finances, financial gain, and they don't cover most of what I do. So, but we've made our blood sugar recovery plan so affordable that 96% of all the patients that come to us, they can come in and for as little as $200 to $400 a month for 18 months. Now, most of my care plans are around 5-6 months, all right, that we monitor and take care of you, right? But for $200 to $400 a month for 18-month payment. It's not an 18-month plan, it's usually right around a 6-month plan. But my plans include everything, all the testing, all the treatments, all the supplementation, the neurofeedback, all of it's included, all right? There will not be anything that will be a surprise to you, I promise. So 6 things that I want you to think about before we finish up here. On a scale of 1 to 10, how serious is your illness, right? Where do you see yourself in 3 years? It's not going to get any better if you don't make changes. How's this affected your relationships, your work, your ability to enjoy life? I know when I was sick, I lost the love of my life, right? Engaged to a wonderful gal, and we've been together 5 years, and because I got so sick, and because my personality changed so much, she couldn't take it and she split. You know, how devastating was that? Think of 3 things that you could do if you didn't have blood sugar issues. You know, would you go back and play golf or tennis? Would you travel? Would you be able to be a better support person to the other person in your life or to your children, right? Instead of going from doctor to doctor to doctor, wasting all your time doing all that, what else could you be doing, right? What could you fill in the time with rather than feeling sick and going to doctors? Really important. On a scale of 1 to 10, how serious are you about eliminating your illness? Look, I'm looking for 8, 9s, and 10s, right? You got to be serious about this. If you're not that serious, please don't call, don't become part of my practice. When you get sick enough and you get serious enough, give me a call. Be happy to help you. So due to time constraints, I can only accept those who are truly committed. If you're not truly committed to getting healthy, please, 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 please don't sign up, don't call me, don't become part of the practice until you are. It's a waste of everybody's time. And time is the only precious element in our bodies and our lives that we can't get back. I want to thank you very much for the moment and the time that we spent together. Our office phone number is there. Our website is there. If you have any other questions, you want to get a hold of us, you can get a hold of us through those ways. Or you could also do my office email, askdrharper@att.net, askdrharper@att.net. I wish you all the best. Good luck and God bless.